If you've ever had surgery, you know exactly what I'm talking about. You get this long list of do's and don'ts, and honestly, it can be a little overwhelming. Well, there's one piece of advice pretty much everyone gets, and today we're going to dig in and see if it's actually true.
So let's just get right to it. Is taking a shower or a bath after an operation really that big of a deal? I mean, are we right to be so worried about getting a wound wet? Or is this just one of those things we've been told for so long that we just never stop to question it?
Okay, let's start with what we all think we know. This piece of advice is so common it's practically been passed down from doctor to patient for generations. It feels like a fundamental rule of recovery. You've definitely heard this one before, right? Just stay away from water, don't get the wound wet, period. And you know, on the surface, it makes a certain amount of sense. But where did this idea even come from in the first place?
To really get why this idea has had such staying power, we need to take a quick look back. The history here is actually pretty important.
You see, these fears weren't just made up. They were based on the medical reality of the time. Think about it. You had stitches that could actually dissolve if they got too wet. The risk of infection from water that wasn't always clean was very real, and the prevailing wisdom was that the only way to heal was to keep a wound totally, completely dry.
But of course, that was then, and this is now. So what does modern science actually have to say about all this? Let's separate the facts from the fiction.
And here is the big twist in the story. The old way of thinking was that water automatically meant a higher risk of infection. But what we know now is the complete opposite. Good hygiene, which includes gentle washing, actually lowers your infection risk by keeping the area clean.
So what changed? What's the secret sauce? Well, it's technology. Modern surgical dressings are amazing. They're basically like a waterproof shield for your wound. They're specifically designed to be water-resistant so you can get clean without having to worry. It's a total game changer for patient comfort.
So how soon is too soon? You might actually be surprised. Instead of waiting for weeks, a lot of surgeons will give you the go-ahead for a gentle shower in just a day or two. But, and listen, this is really important, you always have to get the specific okay from your surgeon first.
All right, so you've gotten the green light from your doctor to take a shower. Great. Now what? Let's walk through the simple steps to make sure you do it safely and keep your recovery moving in the right direction.
Here's your 4-step cheat sheet. Number 1, and I can't say this enough, get your doctor's official okay. 2, double-check your dressing, make sure it's on there securely. 3, wash very gently with some mild soap and water, we're not scrubbing here. And last, number 4, just gently pat the area dry with a clean towel. See? Simple.
Now, just because you can take a shower, that does not mean it's time to go for a swim. It is super important to avoid soaking in a bathtub. And swimming pools or hot tubs? Absolutely not. Not until you are fully healed. A quick, gentle wash is one thing, but a long soak is a completely different story.
So what's the big takeaway here? When it comes down to it, good hygiene isn't something to be afraid of after surgery. It's actually your friend. Let's quickly recap why a proper, clean routine is so good for you.
So why is this so critical? Well, for starters, a gentle wash gets rid of all that sweat, dirt, and bacteria that can build up on your skin. That right there helps keep the wound clean and seriously lowers your risk of infection. And let's be real, after surgery, a nice shower can make you feel human again. It's a huge boost for your comfort and your mood. If you only remember one thing from all this, let it be this. When it comes to healing, hygiene is on your team. It's your friend, not your enemy. It's a simple but really powerful way to help your body do its thing and recover.
So we just busted a pretty big medical myth today, and it kind of makes you think, doesn't it? What other common sense health advice are we all following without even thinking about it? Maybe it's time we started asking a few more questions.